Hey there, it's Dr. Jim Collins. Thank you so much for stopping by. This week I have a very good topic on post-traumatic stress disorder, or PTSD, but in later life among older adults. So let's start from the beginning. According to the Diagnostic and Statistical Manual 5, which is the DSM 5, the lifetime risk for developing post traumatic stress disorder is 8.7%, and the 12-month prevalence among US adults is around 3.5%. So the US seems to have a higher incidence of PTSD compared to other nations in Europe, Asia, Africa, and Latin America, whose numbers are between 0.5% and 1%. So we are well above that. Rates of PTSD are higher among veterans and those who have chosen vocations that increase their risk for exposure to traumatic events, including firefighters, police, and emergency medical personnel. The highest rates, though, of PTSD are among those who have experienced highly traumatic events, such as rape, military combat, military captivity, and ethnically or politically motivated internment and genocide. So that's a little introduction just to give you an update about some facts and figures about PTSD in the US and around the world. Now, in terms of the older adult, the prevalence of full threshold PTSD appears to be lower among older adults compared to the rest of the population. That's a good thing. But subthreshold, which means all of the elements of PTSD are not present. Subhold presentations are more common than full PTSD later in life, especially to older adults. Symptoms related to later life PTSD are associated with substantial clinical impairment. Symptoms of PTSD can occur at any age and usually do begin within 3 months after the traumatic event has occurred. But there can be a delay in symptoms for months and sometimes even years. And when that occurs, this is called delayed expression PTSD. And of course, symptoms and duration will vary over time. Complete recovery within 3 months occurs for almost half of adults who have PTSD. Some individuals remain symptomatic for over 12 months, and there are documented cases of up to 50 years. And that's just horrifying. For the older adult, though, declining health, worsening cognitive function, and social isolation may all exacerbate PTSD symptoms. Individuals who experience PTSD in older adulthood may express fewer symptoms of the classic PTSD symptoms like hyperarousal, avoidance, and negative cognitions and mood. Although older adults who experience PTSD later in life can actually display those symptoms. So that's interesting. In older adults, PTSD is often associated with negative health perceptions, primary care utilization, and suicidal ideation. So it's a very, very serious thing. I'd like to end on this, that seniors living in skilled nursing and assisted living around the country are now being recognized more for their symptoms of PTSD. There's a movement for healthcare professionals to become trained in trauma-induced care. And that's a really good thing. That's a new trend that's happening right now, trauma-induced care, trauma-related care. It's called a few different things. but I'm glad it's happening now because I really do believe that a lot of seniors have gone undiagnosed and therefore untreated when they truly do have symptoms of PTSD. So thanks for spending some time with me. I'm Dr. Jim, and I'll see you soon.